before you take another step today. Stop. Look down at your legs right now. If you see dark, twisted, rope-like veins bulging beneath your skin, or if your legs feel heavy and sore by the evening even when you have not done much, what I am about to share with you could change the next 5 years of your life. Because most people treat this as a cosmetic problem, a vanity issue, something to hide under long pants and move on. But here is what your doctor may not have told you. Those veins are not just ugly. They are a warning signal. And if you ignore them long enough, they stop being just a leg problem. Stay with me through this entire video, because the last part is the part most people never hear. And it is the part that actually fixes this. I am Dr. Christian O'Brien, board certified in preventive and metabolic medicine. Over 15 years in clinical practice, I have watched this condition quietly rob people of their mobility, their confidence, and eventually their vascular health. And I have had enough of watching patients get told there is nothing to do but surgery or compression socks. There is a better way. Let me show it to you. Let me describe someone I see in my clinic all the time. She is 62 years old. She spent 30 years on her feet, teaching, nursing, managing, raising a family. She wears dark slacks now because her legs embarrass her. By 3 in the afternoon, her ankles are puffy. By evening, there is an ache in her calves that feels like something is wringing them out. She has been told she has varicose veins. She has been told to wear compression stockings and maybe consider a procedure. But no one ever explained to her why this happened, what is actually going wrong inside her legs, or what she can do about it before it gets worse. If that sounds like you, or someone you love, you are in exactly the right place. Here is what is actually happening inside those veins. And I want you to picture this clearly. Your legs are about as far from your heart as your body gets. Every time your heart pumps blood out, it travels all the way down to your feet. Then gravity becomes the enemy. The blood has to travel back up. And to help it do that, the veins in your legs have tiny valves inside them, like little one-way doors that open to let blood pass upward and then snap shut so the blood cannot fall back down. When those valves work properly, circulation flows smoothly. When they fail, the blood pools. It sits in the vein. It builds pressure. The vein walls stretch under that pressure. They balloon out. They twist. They become the dark rope-like ridges you can see or feel under the skin. That is a varicose vein. It is not a cosmetic flaw. It is a broken valve system under pressure. And here is why that matters more than most people realize. A study published in the Journal of Vascular Surgery, following over 4,000 adults between the ages of 50 and 75, found that people with untreated varicose veins had a significantly elevated risk of developing deep vein thrombosis, blood clots in the deeper leg veins, compared to people with healthy vein function. We are not talking about spider veins or surface discoloration. We are talking about a structural failure in a system your body depends on every single day. Now the question everyone asks me is, why do those valves fail in the first place? And there is not one single answer. There are several. But I am going to take you through the most important ones, because understanding why this happens is how you stop it from getting worse. We are going to go from the least surprising cause to the one most people have never considered. And that last one, I promise you, is the one that is doing the most damage right now. The first thing that breaks down those valves is prolonged sitting or standing without movement. When you are on your feet for hours or sitting at a desk all day, the muscles in your calves are not contracting, and your calf muscles are not just there to move you around. They are actually a pump. When those muscles squeeze with every step you take, they push blood upward through the veins. Without that squeezing, the blood in the lower leg just sits there. Gravity holds it down. The valves bear all the pressure. Over years, they wear out. A review from researchers at the University of Edinburgh analyzed data from over 6,000 workers in sedentary and standing occupations and found that people with the lowest daily movement had valve dysfunction rates nearly twice as high as those who walked regularly throughout their day. Twice as high. And here is the practical truth. It is not about going to the gym. It is about the small movements, the breaks, the short walks, every hour that keep your calf pump working. The second factor is body weight. Extra weight does not just put pressure on your knees and hips, it increases the pressure inside the abdominal cavity, the space in your core, and that pressure pushes down on the veins that drain blood from your legs. Imagine you are trying to empty a garden hose, but someone is standing on the middle of it. The water backs up. That is what excess abdominal weight does to your leg veins. The valves downstream are fighting against back pressure they were never designed to handle. Research published in Phlebology, a journal dedicated entirely to vein disorders, found that for every unit of increase in body mass index above normal range, the risk of vein valve incompetence increased by approximately 7%. That compounds over time. And what is encouraging is that even modest reductions in abdominal weight, not dramatic transformations, can measurably reduce that back pressure. If you have been finding this information useful, please take 2 seconds right now to subscribe and leave a comment below. It tells me that you want more of this kind of content, and it genuinely helps this channel reach people who need it. Now, back to what matters most, because what I am about to share next is the factor almost no one talks about, and it is likely the most correctable one in your life right now. The third factor is chronic inflammation inside the vein walls themselves. And this is where the conversation shifts from mechanics to biology, because this is where we can actually intervene powerfully. When your body is in a state of chronic low-grade inflammation, which affects the majority of adults over 50 who eat a standard Western diet, that inflammation does not stay in one place. It circulates, and one of the places it lands is the walls of your veins. Inflamed vein walls lose their elasticity. They become stiff and weak. They cannot support the valves properly. The valves begin to leak. And once a valve starts leaking, the increased pressure in the vein below it accelerates inflammation further. It becomes a self-reinforcing cycle. A landmark study out of Harvard School of Public Health, looking at vascular inflammation markers in over 3,000 adults aged 50 to 70, found that individuals with elevated C-reactive protein levels, which is a standard blood marker of systemic inflammation, had significantly higher rates of venous insufficiency than those with lower inflammation levels. The researchers noted that dietary patterns accounted for a substantial portion of the variation in those inflammation markers. What you eat is changing the chemistry inside your veins. Every single day. And stay with me here because this is the part that gives you real power. Because inflammation is not fate. It is not fixed. It is a variable you can influence starting today, with what you put on your plate, with how you move, and with one specific habit that I am going to walk you through in the protocol section of this video. Before I get there, let me tell you about Margaret. She was 67 years old when she came to see me. Both legs had visible varicose veins along the inner calf and thigh, and she had developed chronic swelling in her lower ankles that left a visible indentation when she pressed her finger in. We call that pitting edema, and it tells us the venous pressure is significant. Her C-reactive protein, that inflammation marker I mentioned, was 4.8 milligrams per liter. Anything above 3 is considered elevated risk territory. Her calf circumference at its widest point was 43 centimeters. She was sedentary for most of her day. She ate a diet heavy in processed foods and low in plant diversity. We did not put her on a drug protocol. We did not send her straight to a vascular surgeon. We put her on a structured, evidence-based 4-pillar plan. And I want to be clear here. I am not asking you to skip your doctor. I want you to bring this information to your own physician and have that conversation. Work with your medical team. What Margaret did worked for her because it was monitored and supported. After 14 weeks, her C-reactive protein had dropped to 2.1. Her ankle swelling was essentially gone. Her calf measurement had reduced to 39 centimeters. The veins were still visible but smaller, softer, and she described the leg ache as having gone from a 7 out of 10 every evening to a 2. She had lost 12 pounds, not from a crash diet, but from the dietary shift that reduced her inflammation. She told me her legs felt like they belonged to her again. That is what this approach can do. Now let me take you through that plan, step by step, the same way I would walk a patient through it in my clinic. The foundation of this plan is what I call targeted anti-inflammatory nutrition. Not a diet in the trendy sense, a deliberate shift in what goes into your body every day, aimed specifically at reducing the vascular inflammation that is weakening your vein walls. The three most critical moves here are increasing your flavonoid intake, dramatically reducing your processed sodium intake, and adding foods rich in vitamin C and bioflavonoids that directly support collagen in the vein walls. Flavonoids are plant compounds found in dark berries, red grapes, citrus pith, and dark leafy greens. They are not exotic supplements, they are foods. Researchers at the University of Sydney conducted a 12-week study in which participants with mild to moderate venous insufficiency added 2 daily servings of flavonoid-rich foods to their existing diet. At the end of the study, participants showed a measurable reduction in venous reflux, the backflow of blood through leaking valves, and reported significant reduction in leg heaviness and nighttime cramping. 12 weeks, 2 servings a day. That is not a dramatic intervention. Processed sodium is the other side of that coin. High sodium intake causes your body to retain water. That retained water raises the fluid pressure in your tissues and in your veins. If you are eating packaged foods, deli meats, canned soups, or fast food regularly, your sodium intake may be contributing directly to the swelling and pressure in your legs. You do not have to become obsessive about this. You have to become aware of it and shift it gradually toward whole foods with natural sodium levels. Vitamin C is the building block of collagen, and your vein walls are largely made of collagen. Without adequate vitamin C, those walls become fragile. A study in the Annals of Vascular Surgery found that patients with chronic venous insufficiency had measurably lower circulating vitamin C levels than vascularly healthy controls of the same age. The connection is real, and fixing it is as simple as consistently eating citrus, bell peppers, kiwi, and broccoli, foods that are already in most grocery stores in Rawalpindi and everywhere else around the world. The second pillar of the plan is calf muscle activation. I told you earlier that the calf is a pump. If the pump is weak or underused, the veins suffer. You do not need a gym for this. You need a wall and 10 minutes. The exercise is a calf raise. You stand near a wall for balance, rise up on your toes slowly, hold for 2 seconds, and lower back down slowly. That full range of motion squeezes the calf muscle completely, activating the pump. Research from a team at Johns Hopkins found that a program of 25 controlled calf raises performed twice daily reduced measured venous reflux by 18% in participants with mild valve incompetence over an 8-week period. 18% reduction in backflow. From an exercise you can do in your kitchen. Pair the calf raises with one simple behavioral change. Never sit still for longer than 45 minutes. Set a timer if you need to. Stand up and walk for 2 minutes. Shift your weight. Do a few calf raises right there in the kitchen or living room. That movement is not just good for your cardiovascular health broadly. It is specifically resetting the pump in your legs every hour. The third pillar is leg elevation, and I want to explain why it works so you will actually do it consistently, rather than thinking of it as a passive and pointless thing. When you elevate your legs above the level of your heart, you are using gravity on your side for once. Blood drains from the pooled areas back toward the central circulation. The pressure inside the swollen venous segment drops. The vein wall gets a rest from that constant outward force. Over time, this allows some of the inflammation in those walls to quiet down. It also dramatically reduces the swelling that comes with venous insufficiency. The protocol here is specific. Lie down on a flat surface. Prop your legs up on 2 or 3 firm pillows so your feet are above the level of your chest. Do this for 20 minutes at least once a day, preferably in the late afternoon or early evening when venous pressure in the legs tends to be at its highest after a full day of gravity's work. This is not a cure on its own. It is a daily maintenance step that, combined with the others, makes a measurable difference. The fourth pillar is compression, but not the way most people use it. Most people put compression socks on in the morning, forget about them by midday, and pull them off the moment they get home. For compression to do its job, timing and consistency matter. You put compression socks on before you get out of bed in the morning, before you stand up and let gravity start pushing blood down. You wear them consistently throughout your active hours. The compression grade matters too. Over-the-counter socks are often too light. A graduated compression stocking in the 15 to 20 millimeter of mercury range is a starting point for visible varicose veins. Your own doctor or a pharmacist can help you find the right level for your situation. A clinical trial published in the European Journal of Vascular and Endovascular Surgery, involving over 800 participants with symptomatic varicose veins, found that consistent use of properly fitted graduated compression stockings over 6 months resulted in measurable reduction in vein diameter and significant improvement in symptom scores including pain, heaviness, and nighttime cramps. These are not miracle socks. They are a mechanical tool that works when used correctly and consistently. Now let me bring this together into something you can actually start today. This is not a protocol that asks you to overhaul your entire life in 1 week. It is a layered approach where each step reinforces the others. You start with your nutrition, 2 servings of flavonoid-rich foods daily, reduce the packaged food and processed sodium, add citrus and colored vegetables every day. You pair that with calf raises twice a day, 25 repetitions each time, plus a movement break every 45 minutes of sitting. You add 20 minutes of leg elevation every afternoon. And you commit to wearing compression stockings correctly, on before you stand up, off at the end of your active day. These 4 pillars are not separate strategies. They are parts of a single system. The nutrition reduces vein wall inflammation. The calf activation strengthens the pump. The elevation gives the venous system a daily pressure reset. The compression supports the vein walls against the forces they face during the day. Together, they address the underlying mechanism of varicose vein progression in a way that a single intervention never can. What you have learned today is something that most people with varicose veins never hear from their doctor. Not because their doctor does not care, but because there is simply not enough time in a 15-minute appointment to explain vein valve mechanics, vascular inflammation, calf pump physiology, and a 4-step non-surgical protocol. You now understand the mechanism. You understand why your veins failed, and you know what to do about it. Those dark, twisted veins in your legs are not your identity. They are not your destiny. They are a sign that your body has been under a specific kind of stress for a long time, and that stress can be addressed, not with surgery, not necessarily with procedures, with knowledge, consistency, and a plan that you can start today. The power here is yours. You decide what goes on your plate. You decide whether you stand up every 45 minutes or stay seated for 3 hours straight. You decide whether you do the calf raises or skip them. No one else is in that room with you. And no supplement, no procedure, no prescription has ever done for patients what sustained, informed daily choices have done. I have watched people in their 60s and 70s reverse the trajectory of this condition and reclaim legs they thought were gone. Margaret is not an exception. She is what happens when someone understands what is actually happening in their body and decides to do something about it. To recap what matters most from this video, varicose veins are caused by failing one-way valves inside your leg veins, and those valves fail because of chronic low movement, increased abdominal pressure, and persistent vascular inflammation. Inflammation is the most correctable factor, and diet is the most powerful lever. Flavonoid-rich plant foods, reduced sodium, and consistent vitamin C intake directly support the vein walls. Calf raises and regular movement activate your natural leg pump. Daily leg elevation takes pressure off the venous system. Properly fitted compression stockings support the walls mechanically throughout the day. None of these alone transforms the condition. All 4 together, done consistently over weeks, change its trajectory. If you found this video valuable, please share it right now with someone in your family, a sister, a mother, a friend who always complains about tired legs or swollen ankles and has never been given a real explanation or a real plan. Sharing this is not a marketing gesture. It is an act of care. And while you are here, subscribe to this channel so you do not miss what is coming next. Because in the next video, I am going to show you what is happening inside your arteries when your legs hurt at night, and why that is a completely different problem that requires a completely different approach. You do not want to confuse the two. The difference matters more than most people know. I am Dr. Christian O'Brien, and I will see you in the next one. Take care of yourself.